This is Mike. Mike is a family physician based in Ohio. He likes to share ideas about medicine with other healthcare professionals all over the world using social media. Mike has his own blog where he writes about medicine. He also speaks his mind on his podcast, on Facebook, and using LinkedIn and Google+. Mike's Twitter profile is followed by around 15,000 people, many of them other physicians. Let's take a look at just one of those followers. Here's Kevin. Kevin is an internal medicine physician in New Hampshire who writes a blog about medical news that gets millions of visitors. He has over 100,000 followers on Facebook, Twitter, Google+, and LinkedIn. One of Kevin's followers is Anne-Marie. Anne-Marie is a primary care physician based in the UK. Yes, that's in Europe. Doctors are using social media all over the world. Anne-Marie writes on her blog and she posts on Google+ and on Twitter. She has posted over 100,000 tweets. I bet you're wondering, how do these doctors get any real work done? Well, the truth is, social media is a crucial part of their real work. In fact, right now, healthcare professionals all over the world are talking and learning from each other through discussion forums, blogs, all sorts of social media sites like Twitter, Facebook, Google+, LinkedIn, and others. This is great news for anybody who wants to learn what doctors are saying about, well, anything at all. Let's say you're a medical student studying cardiology. You can connect online with thousands of qualified cardiologists and hear what they're saying about the latest treatments. Or let's say you work for a pharmaceutical company and you want to know what physicians think about your new drug. Are they worried about efficacy or safety? If you could hear what they say to each other, you'd discover right away how they feel. And then you could make sure you get the right messages to your customers just when it matters most. There are literally hundreds of thousands of healthcare professionals using public social media, just like Mike, Kevin, and Anne-Marie. But the problem is, listening to them isn't so easy because their voices are drowned out by the millions of other people tweeting, blogging, and commenting online. In fact, it has been essentially impossible to isolate the voices of healthcare professionals using social media monitoring tools. Until now. That's why we invented Creation Pinpoint. Creation Pinpoint is a new service that distills just the conversations taking place among healthcare professionals in public social media and tells you what physicians, surgeons, pharmacists, or nurses are saying about your products or therapy areas in over 100 countries worldwide. Here's how we do it. We start with one of the world's leading social media monitoring platforms, which is tracking billions of tweets, posts, and mentions from over 70 million sources online. Then we add the Creation Pinpoint Big Data Engine, which has hundreds of thousands of healthcare professionals' social media profiles, sites, and blogs, and it's growing all the time. We built it using proprietary algorithms that index healthcare professionals and at the same time learn about their behavior. That means the more profiles our data engine studies, the more intelligent it gets. Finally, we add the expertise of our global team of seasoned researchers and pharmaceutical marketing gurus to turn the insights we learn from healthcare professionals' conversations into strategic recommendations that will make all the difference to your brand. So, not only can we listen to the right healthcare professionals, but we can also listen to what they say about what's important to you. Then, we turn that into an easily digestible report to guide your decision-making. To get started, go to creationpinpoint.com and tell us what you would like to hear physicians talking about. Creation Pinpoint. It's the fastest way to hear what physicians really think.